indicate good hemoglobin concentration. You can compare color. There may be jaundice, yellow color, and then flip the hand, compare again color, and then see the pulp. You can see the cyanosis, okay? And then you do the capillary refill test, pinch it, and see the refill. So, okay. Then, in this position, see the profile view. Profile view means I want to check this angle.
Clubbing.
Yeah, normally there will be an angulation here. In clubbing, it is elevated, right? The profile view. Then take one finger and feel whether it is a drumstick shape or not. Drumstick means, and then you do this test known as Samroth window test. If you see the window, it's a diamond shaped window. So you can see, right? If you see this diamond shaped window, that means there is no clubbing. So you have checked what? You have checked for the colors, that is those, anemia, jaundice, and cyanosis. You have checked all the colors. You have checked the nail changes, like whether it is clubbing or not. If there is a spoon-shaped nail, you can say scolonychia. It's brittle, it's whitish nail is a leuconychia. So you have seen all those things at once in a different position of the hand. Then radial pulse. Okay, obviously you should wear your watch, not the digital one. Analog is better because you can see. Okay, then handshake, 3 fingers. First, locate the pulse, slightly pinch the pulse so that the middle finger can easily feel the pulse. Once you feel the pulse, once you feel it, then you flex the hand. Okay, see, flex the hand. Now start counting the pulse. Count the pulse. If the pulse is regular, count till 15 seconds and multiply by 4. If it is 20 in 15 seconds, it is 80 in 1 minute. Right? If it is irregular, then count for whole 1 minute. Regular, 15 seconds is okay. It's irregular, count for whole 1 minute. Once you count, always think about the 3 things at least. Rate, rate, rhythm, and the volume. Like I said, this is 80 beats per minute, it's regular and normal volume. Right? Then check the blood pressure. You know how to do it, so I'm not showing it here. And if you have a thermometer, I'll check the temperature, sir. And then pulse oximeter, you measure the saturation of the oxygen and you can check the respiratory rate. But if you do pulse oximeter, it's fine. Now you have finished till here, right? Done. Now you come downward and check the medial malleolus, and then check for the pitting edema. Check. So no. See, now I think we have done a lot of things here. Anemia, jaundice, oral cavities, dehydration status, pulse, of all those vitals, nail changes. We have done it. Now, lymph node is left. Okay. So for lymph node, you can check the cervical, axillary, inguinal. See, you can check the abdomen also. You can check the pituitary also. Normally, cervical, axillary, and the inguinal. So inguinal lymph node. Here we have two set of lymph nodes, superficial and deep. Superficial lies in the T fashion, T, and deep lies at the near the this pubic tubercle or symphysis, near the pubic tubercle. So feel like this, rotate by the palm of finger. Feel, feel, feel. Then at the deep here, feel. You have to feel in the both sides, right? Now cervical, okay, cervical. You can sit up. Let's come and sit here. You can ask the patient to sit in the bed also. No need to sit in the chair, but just to show you. Okay. Now, cervical means you should be standing, patient should be sitting position, right? Then this is submental. Submental. Again, rotate and feel. This submandibular. Submandibular, you have to put a hand in cupping position, and then slightly flex, and then okay, done. So this muscle is known as sternocleidomastoid. So along the anterior border there is the anterior chain, along the posterior border there is the posterior chain, right? So here you just check the preauricular in front of the ear. You can check post-auricular, check it. Then rotate the head slightly. You get this border. Then from the border, upper part of the border, just rotate. Feel along the anterior chain. Done. Rotate. Feel along the anterior chain. You should not feel at once because there is a carotid artery. You may obstruct the carotid artery flow to the brain, or you may activate the baroreceptor, causing symptoms. So don't do at once, one by one. See, my hand is at the head, one by one. Rotate, rotate, and then posterior chain. This is along the posterior chain, right? So you can use your thumb and feel the posterior chain. Postauricular and feel the posterior chain. Done. Now this is clavicle, right? Now you have to check the supraclavicular also. So once you do that, before you have to say, I'll put a hand over here, you have to shrug. Shrug means like this, See here? Okay. Once I put, then only, okay? Now please shrug. Yeah. Once you shrug, there will be a gap. So you can feel along the gap about the supraclavicular lymph node. This will conclude the cervical lymph node. Okay. What to expect? Lymph node may be enlarged, tender, non-tender, painful, non-painful, hard or rubbery or normal, or single lymph node or matted lymph node. For example, the patient is having a cough, chronic cough for a long time, and it is a case of suspicious tuberculosis. Then don't forget to examine the lymph node because you'll find the matted, matted form, this irregular lymph node. If patient is a case of any cancer anywhere in the body, like in the abdominal area or the genital area cancer, it will also come to the what? Left supraclavicular lymph node. So we find a hard, irregular, non-tender supraclavicular lymph node. In a case of suspicious any abdominal cancers like stomach cancer or any an organ cancer in the stomach, abdomen or below that, then it's a case of metastatic. Already stomach cancer, left supraclavicular lymph node enlargement means it's always stage 4 inoperable case. So always just examine the lymph node for these cases, right? Then axillary, right? Axillary means axilla drain the upper limb and the chest. So in the case of breast disease, don't ever forget to examine the axilla. It's a mandatory. Okay. And also in any lump and ulcers in the upper limb, don't forget to palpate the axilla. It is a penile cancer. Don't forget to palpate the inguinal lymph node. In the case of testicular cancer, yes, aortic lymph node, intra-aortocaval, all those aortic lymph nodes to palpate. Depending on the situation, you have to, if you have that much of understanding, then you'll do better. So breast is mandatory to examine the cancer, right? And how to examine the axilla? Come here. See? Okay. So better is patient may be standing or sitting position, right? If you want to sit here. Can you see? This is the position, okay? So that your left hand is free now. So here you have to understand this is axilla. This muscle is known as anter-axillary fold. This is posterior-axillary fold. This is the medial wall. This is the lateral wall. This is the apex of the axilla. Right? So we palpate along these walls. Feel along this wall. That's it. We can divide the axillary lymph node anatomically, like anterior loop, lateral loop, posterior loop, all those things, or surgically as level 1, 2, 3. That is surgically. You cannot say level 1, 2, 3 here. Okay. If you open the axilla, then you find the pectoralis minor muscle. If it is behind that, it's level 2. Above or medially is level 1, 3. Below is level 1. You know that very well, right? You know that from the theory part. Here, see this lateral group, medial group, anterior group, and then for the central, you just put at the apex, drop it down here. Okay, done. And same, I can examine this way also. The hand should be resting here or here, maybe is here, fine. Then feel the wall, lateral wall, anterior fold, center. And for the posterior, here posterior. The fold is now easy to palpate. No? So for posterior, you go back. As it is posterior, you go back and feel at once in this place. This is axillary lymph node. Again, what to expect? Same thing. Enlarged, not enlarged. Hard or normal. Or tender, non-tender. When you calculate, you'll get the findings. If there is a hard lump in the breast, and if there is enlarged lymph node, which is hard, we think about the metastasis. If there is a breast abscess, you will find the enlarged, tender, softer or firm lymph node. It is infected. That's why lymph node examination is mandatory if the case is lump, ulcers, or any suspicious cancer, or any infective origin. You have to palpate the lymph node of draining site. Any head, neck, oral, chest cavity is cervical. Any chest wall area and the upper limb, axillary. Any problem in the genitalia except testis and the limb, lower limb.
Again.
Testicular.
Para.
Lower testis is outside. Actually, it was inside during the development, and that's why. And then it came outside. So once it came outside, it took its blood supply and the lymphatic supply from inside. That's why the lymphatic does always go inside, not outside. It is a part of intra-abdominal content. Then it becomes extra-abdominal. That's why everything goes inside, not outside. Okay, this is the basic. I think you should know. Thank you. So this is the basic examination.